Hello, everybody. Today we are going to be looking at osteoarthritis versus autoinflammatory arthritis. And we even have a special guest for you today. My aunt, Maria DeAngelis, will be with us, and we are going to do a real life case-by-case comparison between herself and myself. So that'll be very interesting, and I'm very excited to chat with her. But first, let us take a minute to figure out the difference between osteoarthritis and autoinflammatory arthritis. Osteoarthritis is also known as degenerative arthritis. This condition occurs when the cartilage or cushion between the joint wears away. This condition is the result of age, injury, overuse, or excessive weight, or also by adding repeated pressure and stress to the joints consistently. Individuals may have genetic risks to develop degeneration. OA is the most common form of arthritis. 1 in 2 people will develop it at some point in their lives. Autoinflammatory arthritis. AiArthritis diseases occur when inflammation from an overactive immune system travels through the bloodstream and attacks joints, tissues, and organs. These diseases stem from issues within the innate immune system, typically caused by changes in certain genes. For some AiArthritis diseases, the causes are unknown. However, viruses have in some cases been linked to onset. While these diseases can occur at any age, since they are triggered in the innate, born with part of the immune system, age of onset tends to be earlier or younger. Usually these diseases are chronic, but remission is possible, particularly if the disease is managed early. Alrighty, now that we have the necessary background on the 2 different types of arthritis, let's jump right into our case comparison, shall we? I am with my beautiful aunt, Maria DeAngelis, and today we are going to be talking about the differences in our case situations for osteoarthritis, which is what my Aunt Maria has, and autoinflammatory arthritis, which is what I have been diagnosed with. For our first topic, we're going to focus on disease onset. Why don't you introduce yourself and tell us a bit about yourself, Maria?
Well, hello, Katelyn, my love. I am a 62-year-old woman. The last 25 years or so of my working life, I worked in the deli, which is a very, believe it or not, difficult, hard job because you're working in very extreme temperatures. You're moving around tremendously, up and down, left to right, and you're picking up weights anywhere from an ounce to 50 pounds. Mm-hmm. And I love the job, and you don't quite realize what it does to your body until you wake up one morning and it hits you in the face. Mm-hmm. But my first experience of pain was in my lower back, and that was in my mid-30s. At the time, they just x-rayed and they said there was some damage in the lower spine, nothing to worry about. So, it comes and goes and you just let it go. But I think it was exacerbated with my working life.
Okay, so then you would say it was just the pain that you were feeling from the wear and tear from the job and everything.
Yeah, and that's what I thought it was. You know what I mean? Mm-hmm. You're kneeling, and then you figure out, well, why when I'm kneeling and I'm slightly bent over, you just figured it's just the job.
Yeah.
You know, you go to work, you go to sleep, you come home, you shower, the pain slows down a little bit, lessens a little bit. You don't put 2 and 2 together.
For the next topic, we are going to go into a deep dive of the diagnosis process. Let's start with what kind of doctor did you approach when you were first experiencing this pain?
You hit a raw nerve there, Katelyn. I've never had a straightforward approach to any of my situations in life. Mm-hmm. But anyways, what kind of triggered it was life became painfully unbearable. Because I was doing a lot of standing in one place. And I was doing a lot of hand use. Again, the cold one not with knives and other stuff. Mm-hmm. And I would be there and I would be in pain, crying, because all of a sudden I realized that I couldn't move. My whole midsection would be locked. Mm-hmm. And knives and things were falling out of my hands. And I never dawned on me it was arthritis. And then one day it just, on vacation, it just smack hit me in the face. And I had no choice at that point. In about 2015, 2016, I did go because my hands inflamed. The doctor sent me for...
Sorry, which doctor did you refer?
So my family physician.
Okay.
My family physician. And it was just, inflammation, just take it easy, take some Advils.
And so did your family physician refer you to a different doctor after that?
Not right away, I don't believe. That timing is a little bit off with me. But I do know at some point I was referred to Women's College Hospital.
And were your symptoms and concerns validated by the doctors? Did they immediately acknowledge that what you were experiencing was true?
You know what? I always thought that, you're sick, something's not there, but nothing was ever sent forward. It was just stopped. Like they did the x-rays, they did what they had to do. But at Women's College Hospital, just say, it's all mild. And I would say to them, for something so mild, why am I in such excruciating pain?
And how did the doctors diagnose you? How long did it take? What was the process to actually give you the OA diagnosis?
It was actually in 2017. I was on vacation and I broke out in hives from head to toe. I went to my family physician, and then my family physician sent me to Women's College. Women's College sent me to Avant-Garde, which is a dermatological emergency clinic. And that's where it all started. They took a biopsy of the rash to see if it was rheumatoid arthritis. And I was off work for months. Women's College didn't really give me any satisfaction. That's when it all went full force.
And that's when you got your official diagnosis of osteoarthritis.
At 2018.
And were you told then what the cause of that disease was?
You know what? When you're dealing with osteoarthritis, people will tell you different things. Because my understanding is that they believe that it's, in my case, it's a mixture of genetics. It's a mixture of work that I did in my life and a mixture of stress.
Okay, and so for our next topic, we are going to talk about treatment. What did they tell you the prognosis of osteoarthritis is?
That you can't get rid of it.
It's chronic.
Chronic, live with it. I was prescribed a medication. My issue is that with medications, my body doesn't
respond well.
Yeah. I started having other health issues. The multidisciplinary pain and disability management specialist actually suggested I could also do injections.
Really? Okay. Have you found any of the treatments to be effective for you?
Well, it takes, it takes years to get them under control. You just got to ride the roller coaster. But I do find that what does help a little bit is I do yoga. I do walks when it's good weather. I'll take my cane. Staying physical. And I find that walks, because I'm visually distracted.
Yeah.
So the sensories that my brain gets kind of helps calm it down. But when I come home an hour later, it hits you back. I did try even medicinal marijuana. Yeah, again, my body just didn't
respond well.
No.
And that takes us perfectly into our last topic, which is our kind of daily life with living with a condition such as this.
It's hell.
How has this disease affected your daily life?
Well, I had to stop working. Again, I couldn't work.
Yeah.
I couldn't work. There are days where, for example, when I'm having a bad spell, my husband has to do the prep the night before for preparing meals the next day. When there are days where I'll just sit in front of the TV. And again, for me, arthritis isn't just the disease. For me, arthritis is the constant. But other issues trigger the arthritis from a 5 to a 10.
Which leads me perfectly to another question that I have. Could you list all of the other conditions that you have?
Oh my gosh. Well, in my knees, I don't know how to say these words, so please bear with me. In my knees, I have bone spurs and hardening of the bone. In my hips, I have mild subchondral sclerosis, quadriceps and enthescopathy. In my upper extremities and hands, I have osteoarthritis, bursitis in the left shoulder. I have osteopenia in my hands. In both hands, I have periarticular osteopenia and bony osteoarthritis. In my L3, L4, and L4 to L5, I have mild space loss and mild end plate sclerosis. And my L5 and S1, I have mild multi-level osteophytes.
Wow. And have you also been
That's not
diagnosed?
including my feet
Yeah.
and my ankles.
Oh my gosh. Have you also been diagnosed with fibromyalgia?
Yes.
Did they say that's a complication of OA or is that unrelated?
It's unrelated, actually.
Unrelated. So it's
Unrelated.
the only one that has been attributed to having osteoarthritis is the bone spurs, correct?
Yes.
Everything else is just along for the ride in terms of having kind of autoimmune conditions, as we say. If you have
Yes,
one, you have
yes.
many, right?
Yeah. And what people don't realize is that other things, like for example, if you have arthritis and osteopenia or whatever, it doesn't necessarily stem that the others come from that.
Yeah.
But the other side factors can bring on the arthritis.
Yeah. So you're saying if you're in a flare, like if your fibromyalgia is acting up, it can then cause your arthritis to act up because your inflammatories are elevated, everything.
Yeah. Yeah.
Absolutely. I know exactly what you're talking about.
And it doesn't take much. I mean, I don't think I have it under control, but I've learned how to live with it, which is another thing. I mean, I was also sent to the Arthritis Society. Mm-hmm. I find that physio, for me in particular, doesn't do much. I did go to the Arthritis Society, but then what happened is COVID hit and I couldn't continue on.
What were you doing at that society?
Well, Women's College suggested I go, and basically they have workshops where they teach you how to deal and how to live.
Coping mechanism.
Like, I have a key fob.
Oh, like an accessibility
Yes,
aid, I
that,
see. So it helps with your wrists, right?
Exactly. Like on my cane, I put a strap. Because if the cane should fall, I can go down with difficulty, but I have difficulty getting back up.
Absolutely. Absolutely. And to wrap this all up, thank you so much. You've been so lovely. The last question I have for you is, what would you say to someone who just received a diagnosis of osteoarthritis?
This may sound cruel. It's a life sentence, but you can live with it.
That's well said.
Thank you again to my wonderful Aunt Maria for giving us a first-hand account of an experience living with osteoarthritis. It does not sound easy and or pleasant, but she is the strongest person that I know, and she can handle it. Keeping with our auto theme, buckle up because I will be giving you a first-hand account of what it's been like for me living with an autoinflammatory arthritic disease. My disease onset story is quite different. I was 23 years old when I was first diagnosed. I was just starting out a master's program abroad in Scotland. I had just finished a chemistry degree and had always dreamed of doing forensic science, so it seemed the logical next step. As I started school, my symptoms were all over the place. Insanely high fevers, extreme night sweats, body shaking chills. I just can't even describe how rough the whole experience was. I was throwing up all the time. Before eating, after eating, I was so cold sometimes. I was under the blankets with 5 different layers on. I also had this rash that at times was raised without any itching. They call it the salmon rash. Eventually, all of the symptoms I was experiencing were so persistent that I knew I needed to see a physician. I just basically didn't have a choice. It was either that or honestly waiting a little bit longer and going to the hospital. And so for my diagnosis process, this was very different because I went to my GP at the school who did blood work right on the spot. And after reviewing my blood work and discovering alarmingly high inflammatory markers, my GP called me within a day or two and said I must see a rheumatologist as soon as possible. Luckily, my symptoms and concerns were entirely validated just because of even the objective blood work that was indicating that there was something very wrong. I definitely waited far too long to approach a doctor, given that it was also incredibly difficult to receive an appointment at a university clinic during cold and flu season. The blood work expedited the process further because it raised so much alarm, so I was kind of fast-tracked to get the attention that I needed. However, I ended up seeing a rheumatologist privately since I was in the UK and I had that option. I was told that even with a stat order, it could be months before being seen publicly, and the situation was too dire to wait. In terms of the cause of my disease, unlike OA, which it's from the wear and tear, from repeated stress, from extra weight,
my disease is inherently idiopathic, meaning that they don't really know what causes it. There was speculation that a disease or stressor may have triggered the initial flare, but ultimately nothing was and still is certain about the cause of my disease. So for treatment of this disease, the prognosis generally focused on addressing the immediate and very pressing flare. Treating the flare required a high dose of prednisone. And this was a very long, drawn out, almost like over the span of 2 years of trial and error medications. Ultimately, what kind of saved me was a high dose prednisone course up to a point of 80 milligrams. Along with 2 biological injections daily. I'm still on 2 injections of Kineret a day, with several other medications, including methotrexate and some other medications that just help deal with some of the side effects of dealing with a condition such as Still's disease. My case in particular required a significant onslaught of trial and error. I was on cyclosporin twice. I was on methotrexate in a pill form initially, twice as well, and that never worked until I went on the liquid form. And to this day, honestly, it's still debated as to what exactly put me in remission once and for all. Was it the methotrexate? Was it the extremely high dose of prednisone? Eventually, it was a combination of all of those high dose, very powerful medications that put me into remission. Ever since being in remission for about properly 6 months, my life has gradually returned to something close to normal. I'm still on a few medications like the methotrexate, like the Kineret, but we are hoping to taper off of those, and most importantly, I'm off of prednisone, which for anyone who has been on prednisone knows that that is definitely one of the worst drugs to be on, although the most effective. So when you need it, but it's always nice to be off of it when you can. All right, so for the last topic, we are going to talk about my day-to-day life in this disease. Unlike osteoarthritis, which is always present, my form of arthritis is present when it's an active flare. When my body is in a flare-up, that is when I'm experiencing symptoms. So for over 2 years, during this flare, I was essentially incapacitated. I barely managed to complete the rest of my master's degree when I was abroad. I required an extensive amount of support from family and accommodations from the university, and luckily I was able to finish, but it was extremely difficult for me. And then for a year after graduation, I was basically stuck at home, requiring extensive support from my parents. After a year of gradual disease progression with no action, I decided that I needed to change doctors. And the doctor that I then started with responded to my condition with an aggressive prednisone jump and also putting me on liquid methotrexate. This severely backfired as it actually resulted in corticosteroid-induced psychosis. But that is an incredibly long story for a different day. In terms of medications now, as I said before, I am still on Kineret injections daily, methotrexate, hydroxychloroquine, along with a few other medications to help with certain symptoms. However, we are definitely hoping to be off of medication in the next few years if everything goes as planned. In terms of coping strategies, during the time, I'm not going to lie, it was pretty dark at times. I received a medicinal cannabis prescription that really helped with even the prednisone symptoms, the sleeping. So I really found it was key to have resources and doctors that are willing to listen and validate your symptoms. And in terms of now that I'm in remission, I try my best to always be active when I can. I've gotten back into working out. I walk long distances, and I try my best to stretch and do yoga, but that's not always a winning battle. At the end of the day, it's always about being in tune with your body, especially when you're sick. Being sick forces you to always actively listen to your body. It's not even a day by day sometimes. It's honestly a minute by minute. You got to check in. You got to see, what do I need? What does my body need? Can I do that? Some days you can do certain things. Some days you can run. Some days you're stuck on the couch and you just got to roll with it and you just got to be okay with it. And you just got to realize that this is the body that you were given, and you can either work against it or you can try and work with it. And once you start realizing that you're working with your body, that perspective change for me was very, very significant. So I think that's more than anything, it's just realizing that your body is only capable of what it's capable of, and you got to treat it with love. It's the only one you have.
Okay, everybody, that brings us to the end of our segment. I'd like to thank Maria DeAngelis again for being such a lovely guest. And I hope you learned something today about either osteoarthritis or autoinflammatory arthritis. So thank you so much for tuning in and take care of yourselves.